Today we're diving into one of the most transformative changes in healthcare, the shift to value-based care. It's not just a buzzword, it's a movement that's reshaping how medical practices operate, get reimbursed, and deliver care. Picture this, a tale of two clinics in the same city. One is thriving under a value-based care model, consistently earning incentives and providing excellent patient outcomes. The other is stuck in the old fee-for-service world, struggling to maintain financial stability with overworked staff and declining patient satisfaction and declining reimbursement. The difference? One embraced change, the other resisted it. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 109, The Future of Medical Practice, Navigating the Shift to Value-Based Care. Welcome to the Medical Money Matters podcast, where we explore the intersection of medicine, finance, and operations to help practices thrive. Today, we're diving into one of the most transformative changes in healthcare, the shift to value-based care. It's not just a buzzword, it's a movement that's reshaping how medical practices operate, get reimbursed, and deliver care. Picture this, a tale of two clinics in the same city. One is thriving under a value-based care model, consistently earning incentives and providing excellent patient outcomes. The other is stuck in the old fee-for-service world, struggling to maintain financial stability with overworked staff and declining patient satisfaction and declining reimbursement. The difference? One embraced change, the other resisted it. The truth is, value-based care isn't going away. It's the future of healthcare, and failing to adapt doesn't just cost money. It can harm your team, your reputation, and your long-term viability. Today, we're going to explore why this shift is so important, the risks of ignoring it, and how practices of any size can successfully transition to a value-based model. Let's start by talking about the risks of not making the shift. For decades, the fee-for-service model was the backbone of healthcare. You provided a service in response to a sick or injured patient, you got paid. But this model rewards volume over value, leading to inefficiencies and rising healthcare costs. As payers and policymakers push for better outcomes and cost control, the value-based care has emerged as a solution. Practices that stick with fee-for-service are finding themselves on the wrong side of progress. Financially, this can be devastating. Payers are increasingly tying reimbursements to quality metrics and cost efficiency. If your practice doesn't participate in value-based programs, you're missing out on incentives and risk being left out of payer networks altogether. It's not just about lost revenue, it's about losing relevance in a changing market. Beyond finances, the impact on your team can be severe. Inefficient workflows and financial instability create stress and burnout for staff. Imagine a team that's constantly scrambling to meet deadlines, to keep up with billing, and to manage patient volume without the support of systems designed for modern care. Over time, this stress erodes morale and drives turnover, making it even harder to maintain high-quality care. Then there's your reputation. Patients and payers are increasingly savvy. They prioritize practices that demonstrate better outcomes and efficient care. Falling behind on value-based initiatives sends a message that your practice is outdated or resistant to innovation. That's not a label any clinic can afford. But the challenges don't end there. One of the biggest obstacles to embracing value-based care is a lack of understanding about how reimbursement works. Physicians, who are often at the helm of these decisions, are experts in medicine, but many are less familiar with the intricacies of reimbursement systems, let alone the complexities of alternative payment models. Let's face it, terms like capitation, bundled payments, and shared savings aren't exactly intuitive. Yet, these models are critical to succeeding in value-based care. Without a clear understanding of how these systems work, it's easy for practices to feel overwhelmed or even paralyzed. This knowledge gap isn't insurmountable, but it does require intentional effort to address. Practices need to prioritize financial education for their leadership teams and consider bringing in experts who can bridge the gap. Healthcare financial analysts, reimbursement consultants, or even a dedicated team member who specializes in these models can be game changers. So why should even small to medium-sized clinics make the shift to value-based care? The answer is simple. The healthcare landscaping is changing for everyone, not just large systems. Programs like MIPS and PCPCH are designed to incentivize quality-based approaches across the board. And it's not just Medicare. Commercial payers are following suit, often requiring value-based contracts as a condition for network participation. For smaller practices, the idea of implementing value-based care might seem daunting, but the benefits far outweigh the challenges. Patients receive better coordinated care, which leads to higher satisfaction and loyalty. Practices gain access to new revenue streams through incentives for high performance. And by focusing on quality over quantity, you can reduce inefficiencies and achieve better outcomes for both patients and providers. To succeed in this shift, you need the right team in place. Negotiating value-based contracts requires someone who understands the metrics that payers care about. This isn't just about getting the best rates, it's about ensuring that the team terms align with your practice's ability to deliver and measure quality outcomes. Equally important is having someone to manage those outcomes within the clinic. This role involves tracking performance on key metrics, identifying areas for improvement, and implementing strategies to ensure success. It's not a luxury, it's a necessity in the value-based care world. Of course, none of this would be possible without technology. Technology is the backbone of value-based care, supporting practices in achieving both excellent patient outcomes and financial stability. Data analytics platforms, for example, are essential for tracking and improving outcomes. They help you identify at-risk patients, monitor chronic conditions, and measure progress on quality metrics. With the right data, you can take proactive steps to address gaps in care and meet payer requirements. Electronic health records play a crucial role as well, but not all EHRs are created equal. To succeed in value-based care, your system needs to be optimized for tracking the metrics that matter most, from patient satisfaction scores to readmission rates. If yours isn't, consider an add-on technology such as those we discussed in episode 89, or perhaps it's time for a new system altogether. You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future episodes downloaded as soon as they're released. Telehealth is another powerful tool. It's not just convenient for patients, it's a cost-effective way to manage chronic conditions, improve access to care, and reduce hospitalizations. These are exactly the kinds of outcomes that value-based care contracts reward. We recently worked with a small practice that was initially hesitant to invest in these technologies. They started with a simple data analytics platform to track patient outcomes. Within 6 months, they saw a dramatic improvement in their performance metrics, which translated into better care for their patients and significant financial incentives from payers. So, how do you begin the transition to value-based care? The first step is assessing your current performance. Take a close look at your outcomes, cost, and patient satisfaction. Where are you excelling and where do you need to improve? This will help you identify the most impactful areas to target first. Next, develop a phased approach. You don't have to overhaul your entire practice overnight. Start with a pilot program focused on a specific population or set of metrics. Learn from that experience and scale your efforts over time. Collaboration with payers is also key. Try not to think of them as adversaries. Think of them as partners. Engage in discussions to negotiate contracts that are both fair and achievable. Finally, align your team. Educate staff about the principles of value-based care and the goals you're working toward. Everyone in the practice, from front desk staff to physicians, plays a role in achieving success. And don't forget the importance of monitoring and continuous improvement. Set up regular reviews to assess your progress, celebrate successes, and adjust strategies as needed. To wrap up, value-based care isn't just the future, it's here. The cost of not adapting is too high to ignore. By addressing knowledge gaps, building the right team, and leveraging technology, you can position your practice for success in this new landscape. Thank you for joining me on today's episode of Medical Money Matters. If you found this discussion valuable, please share it with your colleagues and follow or subscribe to the podcast for more insights. Remember, value-based care isn't just about finances, it's about better outcomes for your patients and a healthier future for your practice. Until next time, stay focused and fiscally fit. Join me for our next episode where we'll be discussing future-proofing your workforce, the offshoring and automation playbook. Thanks for tuning in to today's episode of the Medical Money Matters podcast. Before you go, let me ask you, are you ready to take your medical group's coding to the next level? Because that's where Code Mastery comes in. Code Mastery isn't just another coding program. It's the ultimate physician-to-physician training solution to maximize your revenue and empower your physicians with the skills they need to code confidently and win the coding game. From comprehensive high-octane training to actionable insights, Code Mastery gives you the edge you've been looking for. Don't leave money on the table. Visit healtheps.com/codemastery to learn more and take control of your coding today. Let's transform your practice's financial future starting now. See you next time on the Medical Money Matters podcast.